Hello, everyone.
Hello.
How are you? It's so good to see everyone. We always have Murray, who's the first up. Last up because we've been up for a long time, but it's the earliest at your place, California. Yeah,
That's true.
Oh, wow. Fantastic.
That was
yeah.
Boker Tov,
Boker
the
Tov.
Erev Tov Gamkin.
What time is it with you, Murray?
7 o'clock in the
Oh, wow.
morning.
Wow.
Yeah. Hi, Sarah. It's good to see you. Thanks for joining us. And Ido is here as well. Hi, Ido. How are you?
Hey, Hila, good to see you. Hello, everyone.
Good to
Hi,
see
Ido.
you. And hi, everyone that I don't know.
Sorry, I didn't answer before. I was muted, and I'm also not used to answering to my name. There are always so many other people with the same name. Hi. Thank
Looks like you're unique today, Sarah.
you.
Uh, Excellent. So I'm just going to say welcome to everyone. And today our webinar is going to be actually facilitated by the great Alex Ford, who is a new member of ICAR Collective's team. I'll let you introduce yourself briefly, Alex, and then take it from here. But really wanted to thank everybody. For those who don't know me, I'm Hila Touloub, the executive director of ICAR Collective, and we put together those webinars about once a month. Sometimes they're in English so that we can have also participants from the US like today. And then sometimes they're in Hebrew because we do it for the field, and they end up being in the morning in Israel. The next one is going to be in Hebrew in the morning on the link between trauma and autism. And today we're talking about motion and movement and how important it is for resilience. So Alex, thank you so much. Take it away.
Okay, thank you, Gila. So welcome everyone to Resilience in Motion. That's why we're here today. Movement-based pathways to regulation, connection, and care. So as Gila mentioned, I'm Alex, and I'm here representing ICAO today. I'm facilitating this because I also have a background in movement and sport and somatic movement. So that's why I'm the one. We're here today not to rank a specific approach to movement or to define a specific field, but we're here because something is happening, something is moving across very different practices, whether it's in the ocean or on a mat or even in a dance studio. And we believe that it deserves a serious conversation. We are going to start with Dr. Hila Sharon-David, who is going to give us the conceptual ground beneath everything that we will discuss today. And I'll just introduce you briefly, Hila. So Hila is a sports and exercise psychologist and a lecturer in the MA program in the sports psychology at the College of Management Academic Studies in Israel. And her work bridges research and clinical practice with a focus on helping clinicians integrate movement into everyday mental health care. So it's all yours, Hila.
Thank you so much, Alex. Can I share my screen? Okay. Okay, wonderful. So, hello, everyone. I'm very happy to be here and introduce a topic closely related to my heart, movement-based therapy, and how we can integrate them within mental health care. And today I'd like to start with the questions to the practitioners within this webinar. and ask, what if I told you that you already have the most important therapeutic tool within the room of the therapeutic session? And I'm talking, of course, about our body, your body and the patient's body. And the body is an active agent of change, but we mostly turn towards when we talk about the mental health care. So the insights I'm going to share with you today are going beyond my research lab into my personal story. And at 19, during military service, I was sitting outside my office while all of a sudden I couldn't breathe. I felt as if the world is spinning around me. Thoughts were running in my head. My heartbeat increased to level I didn't know exist. And the only thing I wanted was to escape. I was really ashamed and afraid, and I didn't understand what is happening to me. And panic attacks came one after another. Unfortunately, this is not something random or rare in the Israeli reality or even worldwide. Many soldiers and civilians are exposed to stress and severe chronic stress or even trauma. But to begin with, I couldn't just get rid of the anxiety symptoms. I had to go back to where the symptoms had begun. So I had to go back to my body to reclaim my mental health. And intuitively, I started exercising 3 times a week, a very specific training interval. So over and over again, I was just running, walking, breathing, running, walking, breathing. And I only wanted to go back to myself. But what happened was much deeper than just allowing my anxiety symptoms to disappear. It was also uncovering a much higher potential I always had inside. I became more productive, happier, and even more social. And the most fascinating thing about it is that my change became like a social glue, and I wanted to understand more about it. This transformative experience led to my 15 years of research of how we can use physical activity to reduce stress and improve our well-being. But today, I would like to suggest a new question. How can we, as practitioners, help our clients reconnect with their body and rediscover their own pathway of healing? Because the body is the first place to recover and to understand what the mind is trying to tell us. Movement-based therapies are not just a singular therapy, but an umbrella term to many different therapies, including trauma-sensitive yoga, walk and talk therapy, or for example, exercise psychology, dance movement therapy, and many more. But they all share a similar view that the body and mind cannot be separated. And another view is that movement is an essential part of human health and development. When we move, our mind is more colorful. And this is not just a nice metaphor. This is a neuroscientific fact. When we simply walk, our metabolic system is processed, allowing our emotions and thoughts to be processed and improving our mental health. So just imagine when a client entered the room, sitting in the sofa, we ask them, how are you feeling? They say, I'm fine. But can we count only on words? When we look at the body, sometimes it uncovers a lot of information beyond words, by the symptoms, by sensations. So one important question to ask, and this is a very core aspect of movement-based therapy, is to refer to the body as a knowledge that can allow us to understand more about the feelings. An important study conducted in 2014, Bodily Maps of Emotion, asked 700 people from all over the world to map their emotions like anger, grief, stress within their body. And the results were fascinating and really amazing because the maps were statistically identical across the globe. It means that our entire body is engaged within the process of emotion regulation, and we must refer to it for answers. We can go back to nature to understand more about it and about the role of movement within therapy and specifically for stress regulation. So if we look at animals, what they do instinctively after being exposed to danger or a stressful event, when the danger is gone, they shake their body automatically in order to remove toxic chemicals from their body and to restore psychological balance and physiological balance as well. And we as humans have the same similar mechanism. However, during trauma, we go into the freeze mode. What it means is a lot of stress is stuck within our tissue. One approach that I highly recommend of getting to know when we talk about movement-based therapy is the tension and trauma releasing exercise. We don't have to be exercise instructors in order to integrate movement within therapy. Even by just simple micro movements of shaking the body and shaking specific organs within the body, we can help our clients to release trapped autonomic arousal within the body and allow the release of stress chemicals from the body that is trapped within the tissue. While most of clinicians highly agree that physical activity is important for mental health, most clinicians believe that they have the capacity to integrate physical activity, but they are lack the confidence and they are lack of structured protocols in order to integrate physical activity within their practice. So it may be a bit awkward if I start moving with my client and he is not really aware of what we're doing right now. We must introduce movement-based therapy as part of our practice to actually use it. So today, I would like to introduce a framework that helped me during the past decade to integrate physical activity as part of the mental health practice and allowed other practitioners to do so as well. The AMA framework referred to asking about it, asking about the body and the healthy habits. I will introduce it, model it, so we walk the talk ourselves, and act together. Asking about it, it means that when we refer to our clients, we're not only asking them, how are you feeling, expecting their cognitive aspect to work, but also we refer to the body as a main source of information, asking, for example, where the feeling or emotion or even thought is located within your body. Can you tell me more about this experience? Can you share what does your body need right now in order to cope with this feeling? You will be surprised by the amount of information that the body can expose while we refer to it directly. Another dimension that I highly recommend when we talk about movement-based therapy is to ask about health habits, for example, as part of my intake, or even at the beginning of every therapeutic session, I ask, how much physical activity did you have this week? How is your sleeping routine? Can you tell me a little bit about your stress management technique or management? So when I ask about it, the client can easily implement it into their daily life. The second and maybe the most important aspect, for example, if we want to integrate the physical activity or even micro movements within our therapy, we must do it ourselves. When movement becomes part of our own well-being, it naturally becomes a part of our clinical language because our clients looking at us and they see much beyond words. When we manifest our well-being through being physically active, it will be much easier for us to recommend physical activity compared to a state when we don't do it ourselves. And the last aspect I'd like to introduce is how important it is to act together. We don't have to be yoga instructor, or we don't have to have a gym within our clinic, while it can be a very nice vision to the mental health care. But walk and talk therapy and micro movement practices offer practical, evidence-informed ways to bring movement into everyday clinical care. It means that we can just stretch our hands or stretch our heads, do some micro movements like circular movements within our practice. The evidence exists to support even just a small, tiny movement within the practice, because when we act together with our client, they can easily do it themselves in their daily life. It will be a great support to their mental health.
Thank you. Thank you very much, Hila. I'm going to have to stop you there. And I'd
This
love to
is
give
the
you
end
the
of my
opportunity.
talk, but I'm just going to introduce
Okay.
question to the panel, because that's what we said, that this talk might leave the
Okay,
panel
go
with a
ahead.
question. So what would mental health care look like if movement became a routine, part of assessment, treatment, and recovery, not an optional add-on? So I'd like the panel to discuss that as well. Thank you so
Okay.
much for listening.
Thank you so much. Thank you so much. It was very interesting. Thank you. Okay. So what I'm going to do now is I'm going to bring in the rest of the panel, and I will pose the same question to each of you. But first, I would like to introduce everyone who is on our panel. So let's start with Dr. Ariel Ezra. Maybe you can wave. We all know where you are. There he is. Okay, so Dr. Ariel Ezra, he is a clinical social worker and a trauma therapist, and he's the head of research and development at Hagal Sheli, which is a nonprofit working here in Israel. And he's the head of training at the new Bachelor of Arts in Behavioral Sciences with therapeutic surfing at Ono Academic College, which is the first program of its kind globally. And Ariel will have the opportunity to talk a little bit about that as well. And we have Tali. Where's Tali? Tali, wave. We have Tali, who co-directs Vertigo's Koach Etzion Movement Research Center, and has led the company's resilience programs for evacuated and reserve communities since the Iron Swords War, in partnership with the Ministry of Defense. And we have Rachel. Where's Rachel? There's Rachel. We have Rachel Oren, and she is Israel's first certified facilitator of trauma center, trauma-sensitive yoga. And Rachel works with survivors of complex trauma to help bring their body into the treatment landscape and in support of their recovery. Over the past 10 years, Rachel has worked consistently within a variety of multidisciplinary clinical teams where she facilitates both groups and individuals. So thank you to all of our panelists. And the question that I'm going to pose to each of you, and I'd like you each to answer, is who comes to you and what actually happens when they do? So perhaps, Ariel, would you like to start? Thank you.
Hi, hello everyone. I'm a bit under the weather is the phrase, so I'm sorry about that. Who comes to us? So my wave, Hagal Sheli Association, started out working with the at-risk youth, doing psychoeducational work and trying to use surfing and surf therapy in order to help them back on the right course. But then the Iron Swords War and all that accompanied it really changed the way we act, and we started a lot of trauma-focused surf therapy groups. We always work only with group setting, and we believe in group setting. And the headline for this webinar talks about resilience. And in surf therapy, resilience is the key, because you literally bounce back all the time. You fall down and then you bounce back. And doing it with other people really helps you connect, be vulnerable, and expose yourself in the right way. We also work with people with handicaps, all kinds of handicaps, emotional, physical, communicative, and cognitive handicaps. And we use surfing as a tool to advance resiliency, connection, self-regulation, and other forms.
Okay. Thank you. Thank you very much for the moment. Tali, would you like to go next? So who comes to you? Shomim. So who comes to you, and what actually happens when they do?
Okay. So actually, we are one of the biggest dance company, modern dance company in Israel, already 33 years. And in the last 20 years, we opened a farm, Eco Art Village. And almost 20 years we are working in the Eco Art Village, in dance, in spirit, all kinds of things that has to do with the spirit and ecological aspects. And in this, we have something that I'm in charge of it, and just came back. I was running from Jerusalem. And we had a performance with 70 people. That the most oldest one was 80 years old, 80, and the youngest 24, and with disabled, all kind of disabilities, physically disabilities, disabilities that you cannot see, soldiers that came to us through the years, and we all performed in the academic dance academic in Israel, and it was amazing. And last night we were performing, hundreds and hundreds of people are seeing us, and we are also treating us with exposing what we're doing into the public, and it gives so much resilience that I cannot even start talking about it in words. You need to see it to understand what I'm talking about, but I will try my best. Since the starting of the war, we didn't know that we were preparing ourselves to big event of disaster in this country, and that we will need all our skills and all our studios. We build beautiful studios, everything from mud and ecological, and only to go into it, it's a little bit like the sea. You go into the sea, it's already done. So in our case, you come into the studio full of mud and in the nature, it's almost already done. All the rest, you don't need to interfere too much. That's the real game. If you interfere too much, maybe you destroy the magic. And we also, like Ariel, we also use therapy that has to do with the group, the resilience of the people themselves. And many bodies in the studio start to להדהד, איך אומרים להדהד? How you say?
To mirror each other, or to
resonate.
More than mirror.
Resonate. Mm-hmm.
Resonate.
Exactly. Thank you. They start resonating, and once everybody is starting to resonate, the magic of therapy starting to happen. I don't know if it's therapy even, it's the healing, the part of the healing part of the therapy start to happen. And we do it through a real movement. Like, what does it mean, real? Everything is real movement, but dance. And through those years, we have a real method that has to do with the basic of contact improvisation. We are based on the technique of contact improvisation that has to do a lot with touch and togetherness, and that the body really has what to say to each other, not through the mouth, not through the head. It's really body to body. And I can tell you that yesterday we had a group of soldiers that just finished the Shavim program, that it's 2 months of once a week, the whole day they have a program. And in the class of the movement class that they had, they were, imagine soldiers that were in all ages, and men's and women's, doesn't matter. Everybody was in the war 2 minutes ago, and suddenly they're in the studio, and after 8 times, they are rolling on each other in rolling point and giving their weight into the earth in such a way that it's impossible to imagine that it's possible, first of all. And second, what they say, that they're totally, they don't know themselves, but in a way, in a good way. They're so surprised about the information that is starting to build up inside, the resilience that is starting to build up inside, that they need to continue that. And the amazing thing, that a lot of percent of them either go to do surfing, either going to do yoga, either starting to run, or many guys that are super macho in Israel, they're coming to our class to dance. They like discovered that they're dancers actually. And it's a therapy that is like a little bit like this. It's not totally frontal, but it does miracles that even I cannot really write it down and say that's what it does. It just brings life into body, or body into life again.
Thank
Even
you,
more
Tabby.
than what they had before.
Thank you.
It's
I'm
totally
going to
new.
give you the opportunity to deepen on some more subjects
Yeah,
in a moment.
thank you.
Thank you so much. Rachel, I'd love to hear from you.
Yes, thank you so much. It's wonderful to be here. So my name is Rachel Oren, and like Alex said, I'm Israel's first certified facilitator of trauma center trauma sensitive yoga, or TCTSY for short, which is the world's first and currently only evidence-based module or style of yoga that's been developed and intended for survivors of complex trauma. So those are the people I work with. Complex trauma, anybody who might not be kind of aware of the term, refers to any form of trauma that happens repeatedly or over time and between people. So it's less natural disasters or kind of circumstantial things. It's different forms of abuse, very often starting very early in life. The people who I work with for the most part are above 18, and by the time they've reached that age, they have unfortunately experienced many of the worst things humanity has to offer. And so my role as a facilitator is together with their therapist and within clinical settings to help them discover and develop a healthy, more present, more safe relationship with their body in a way that their body actually becomes a resource for them in life and not something that they have to either manage or dissociate from, or that they feel is triggering and overwhelming. And it really is so much of what Hila said in her opening. It resonated so much because one of the things that is par for the course in the people I see, and I work with men and women, both in English and Hebrew, all kinds of different trauma backgrounds, yes? And of course, terror and war is just an additional layer on top of everything that's already there. But what is par for the course with everybody is how sensations in your body, whether it be a muscle contracting and contracting and extending, or whether it be something physiological like dizziness or maybe a beating heart, or an emotional sensation how these are incredibly overwhelming, destabilizing, and cause a person to not want to be in their body. And so my job, my role is to use yoga forms, different postures and so on, just as a vehicle for exploring sensations in the body. The client or the person in front of me, whether it be a group or an individual, they are always in control of their experience. So that means everything I do is based on choice. They have to opt in to do kind of the work together. There's no kind of teaching per se. I don't teach them anything. I go through them. I go through a process with them of exploring different yoga forms and different sequences as a means for noticing and feeling and interacting with sensation in your body. And this is done within also a therapeutic alliance, therapeutic relationship with me in the same way that they have with their therapist, so that it becomes this kind of 3-point thing. There's the person, there's the yoga, there's their therapy, and then there's the connecting all between us. And so it does become kind of this whole person care that really does help integrate their body and eventually, yes, to help them use their body as a resource, something they can draw upon and use to their benefit as they go on through life. So that's the headline or a brief description of who comes to me.
Thank you. Thank you, Rachel. And we're going to actually take that a little bit deeper now. And I'd like to pose this question to you and to Ariel. The two of you, because, well, TCTSY has got, what, over 20 years of peer-reviewed research behind it. And Ariel Agalsheli is building its evidence base. So what I want to ask you is the same question, but from different positions. So what does the body make possible in trauma recovery that talk-based approaches cannot reach? And what does the trauma-informed approach require in practice to make sure that we're not re-traumatizing? That would be my question to you. And please feel free to, it's to the both of you.
Okay.
I would like to start if it's okay.
Go for it. Go for it.
First of all, Professor Bessel van der Kolk called it, the body keeps the score. Trauma is written in the body, engraved in the body maybe, and you can see it. You can see Tali talked about coming into the sea, and it's the thing itself, sitting inside the sea or going into the water. You can feel the change in the tension in the body, in the muscle tone, in this immersion inside the water. Leaving apart the surfing itself, only being inside this blue space relaxes the body and gives a respite and allows trauma relief. Next, we do teach. Sorry, Rachel, but we have to teach skills in order so people can really ride waves. They have to know how to pedal, where to lay down on the board, where to try to catch the wave, where not. And if you don't do it, if you don't do it well enough, people won't be able to catch waves. They'll get only frustration. So we have to teach them. And you see, only in the teaching, we do it in playful ways, like we play hide and seek, and throughout our intervention and all kinds of manners, so people can advance with the skills without feeling that they're at school now and learning stuff. It's really all through play and with body movements. And when you do that, you get people come to you and say, we were in the water now for an hour and 15 minutes. For no, an hour and 15 minutes, I didn't have any flashback. I wasn't back in a Gaza Strip or anywhere else that the trauma occurred. I was only here, only inside the water, only with my friends, only with the guides, and I was totally immersed and focused on surfing. So that's an experience which is integrative for all domains of the body. It's affective, cognitive, physical, social experience.
Rachel, thank you. Yeah, Rachel, maybe you can talk a little bit to the second part of the question about how we can make sure that movement-based adjunct therapies are moving people towards healing and not back into the wound. Yeah.
Right, for sure. So again, I'm speaking specifically about TCTSY, which is a very specific way of working with the body. And in that, it's based on principles of empowerment of the survivor. So again, keeping in mind that trauma is an absence of choice. It's an extreme absence of choice, an extreme absence of unable to help yourself, not being able to get yourself or other people out, or being able to protect yourself. Very often, it's a slippery slope in yoga to want to help someone to tell them what to do with their body, but we really try in this particular intervention to not do that and instead to invite them to explore what feels appropriate for them. So attention to the power dynamics, so that the dynamics of me either, what's right, what's wrong, very often, that can be a very big gray area, but we're always inviting people to choose how they wish to explore a yoga form in their body. Also, it's collaborative. It's collaborative in terms of what we do in the actual yoga practice. Very often, someone will come in and say, I work with people who for, 10 minutes just noticing sensation in their shoulders and they're done. Now, if I were to force them, no, let's pay attention to your hips, that's getting into a dynamic that is not healthy because I have disempowered them. I am forcing my will on them. And they are again in this position where they're kind of having to respond to what I'm telling them to do versus it being something healthier and more productive within the context of a transparent relationship. So the empowerment of the survivor in that sense is very important. I think transparency and supervision from a clinical professional. I'm not a therapist, and so staying within the scope of my practice, not advising people on their therapy, not talking to them about processing conversations about what happens in their body. I mean, being there for them to give them emotional first aid if they need it, but not necessarily going into areas where their therapist is the key point person, because that's an issue of boundaries. And boundaries in trauma care is really, really crucial. I mean, it's the setting, it's the place. And I think beyond that, just listening to them. These are people who for so long have not been listened to, have not been heard, have not been seen. And I think by being with them, empathy, it sounds cliche, but it's such a powerful tool for someone to actually feel like someone is there in the trenches with them, whether it be on a yoga mat, whether it be on a wave, whether it be, in a dance studio, but like to have someone be there with them. We know based on research that an empathetic relationship is far more powerful than any given modality. And I think that is really, really key. So I think it's power dynamics, transparency, boundaries, and empathy.
Thank you. Thank you, Rachel. I could listen to you talking about that until tomorrow, but okay. I really want to give Ariel the opportunity to talk a little bit about his new program, I think it's important for all of us to hear. And Hila, as you're also coming from, you sit inside the academy, maybe just afterwards a sentence or two on how that resonates with you and how you see, this sort of thing developing in the future. So yeah, if you'd like to start.
Yeah, well, I can say that the idea rose when we thought about connecting surf therapy, which is really a kind of new intervention. There isn't much research about it, and we're working on that with Academy, because we have students that come to our social bachelor degree, and they do internships and in all sorts of cook therapy and uh, working with therapeutic dogs for
Horse riding therapy also.
horse riding
Yeah.
therapy. And we talk about the connection between academy and surf therapy and this collaboration between Ono Academic College and Hagal Sheli is the first of its kind. And in our program, students in the first year, they really participate. Well, they study 3 days. 2 days they go to the campus and learn all the theories. And then 1 day they go to Hagal Sheli in Bat Yam in Israel. And then they participate in a group. They don't do anything else there, just participate, learn how to surf, and then learn how to help others surf. Then the next year, they accompany veterans who guide groups at the Gal Sheli, and they're kind of helpers for these.
So like a mentoring program?
Yeah, exactly. And then the third year, couples of students conduct groups by themselves, of course, with guidance and supervision and all that. And when they finish their work, they have the bachelor degree and a formal certificate that they had training in surf therapy, and they can use it to help others. So that's the idea. It's
exciting.
Sorry?
It's exciting.
It's very exciting. It's the first time this thing happens, and I'm proud to lead it. And hopefully it will be amazing. And we'll have more and more of this.
Thank you.
I'd love to add to what Ariel just said. And first of all, I'd like to start with giving a big strength to what Rachel just said about the empathy and what we allow people when we give them the autonomy to choose and to go back to their body and to use their symptoms in order not just to afraid their body, but to actually use it to understand something. It's like the body whispers all the time. And sometimes we really try to shut it down. That's what I see in my clinic as well. But when we just turn to the body as a friend and allow the body to provide us the knowledge, then we can do magics. And it really relies the ability to do so and to accompany a person in pain is just by having the idea in mind that they are the only one to have the solution. We don't have any solutions for anyone. They only have the solution, and we can be there. And I always tell my students, you only can hold, like in your mind, you hold the candle next to your client. And when you hold the candle, you can help them see something. But it must be a very soft light. It can't be something that would be too strong for them, too strong to what we can bear at a certain moment. Now, going back to academia, I have two visions that are highly related to what I just mentioned and to what Rachel said. The first one is that many people working with clients in the yoga domain or movement, we don't really see psychology integrating within gyms, for example. We don't see people that are, sometimes people turn to physical activity because they have this intuition that they can help themselves through sport or even surfing. But just imagine what would happen if people go into the gym and they will have psychologists to consult with about movement that is related to their mental health, how to do some certain sport when you are maybe experiencing severe stress or other situations that are really traumatic. But people under trauma or severe depression, for example, will not even go to this direction. So another pathway that I would like to suggest, and this is another part of my vision as an academia person, is how do we reconnect psychiatrists or the first person, the first professional, the first physician that the person will turn to, and maybe they will refer them to the specific person, for example, to trauma-sensitive yoga or vertigo or Hagal Sheli. But we must bridge the gap between practice and knowledge, because currently most psychiatrists do not refer to this type of options. And this is something that for me is first in the priority of movement-based therapy and mental health care.
Thank you. Thank you, Hila. Okay, I'd like to pose a question to Rachel and to Tali. I want to ask you about the limits of this work. By that, I mean, who isn't reaching you? And I'm not just talking about, a geographic limitation or lack of an infrastructure, but potentially about economic or psychological barriers to even show up to the work that you're doing. What would it take to change that? Tali, would you like to start?
Yeah. Wow, I had so much to say before, but I will say it in another platform.
We'll have another webinar.
But I think it's what Hila said a little bit about the bridge. That's what is needed right now. In general, we need more bridges. And just for an example, for 20 years, I'm trying to do the improvisation, contact improvisation, disabled and non-disabled, a project of 26 years of mine in the academic. And they didn't have time for us, never had time for us. It always so crowded and busy. And just for an example, like a spoiler, it's the first year that I just came from there, and they looked at me and they said, how come we didn't do it before? So the bridges are starting, the body and the mind and the intellect, all the intellect that we reached and all the body knowledge that we reached through those years are starting to come together. And there are people that their mission is to find how to make these connections. It's the only thing that is missing, because I feel that if somebody wants to come to us, if he has money, doesn't have money, it's far away, it's not far away, everything is no problem at all. The only small problem is that they will know that we exist. So the spreading out, and I think that a webinar like this, and even we are in the same field, work together more, because we're so busy, everybody's so busy, and we're not taking an hour to say, you know what, let's sit down, let's do a hour of yoga in the beach, and I will do a contact session in the sea, and we will discuss how can we spread this amazing chidush. How you say chidush in English? No? Yiddish? Chidush?
Renovation.
Renewal.
Innovation.
Idea that everything has to start going together because the world of separation is already passé. There is no place for this. And we, and people that are listening to us right now, we need to bring this consciousness into the spreading as much as we possible, and then there will be no problem because everybody will arrive, and money issues is it's not a problem. Nothing is a problem. It's just knowledge and spreading and inviting and getting together. And part of what we're doing right now, it's already the starting seeds of this, and when this happens, it has a lot of ripples.
Daddy, thank you
You're welcome.
so much. And this is exactly why ICAR does what it does. Today we're talking about movement, but this is the soul of Amutat ICAR. And so thank you very much for raising that.
I want to say, Tali,
I knew
know
you
what
wanted to jump in.
I just wanted to say, first of all, that also what you're explaining is also about abundance thinking, right? Versus limited thinking. And a lot of us have those limited beliefs about the amount of resources that are out there, or about that. And that's why everybody's trying to protect their own ways of thinking. But really what you're describing is this abundant thinking, that actually we have resources, we're able to do things, and the way we come together is actually the way to use these resources just more effectively. And Murray, that's on the phone here, is a psychiatrist, and I joke that since October 7th we have more and more psychiatrists that are hugging trees, right? And I'm saying that as a joke, but it's not a joke. We are doing more research. We are understanding that the clinic is not the end of where the patient recovers. It's actually maybe just the beginning, right? If they don't find a job, if they don't have a community, if they don't end up back understanding and listening to their body, the psychiatrist hasn't done anything. And I think more and more folks are realizing this, and that's a good thing for all of us.
Thank you, Gita. Great. So Rachel, back to you on the same question.
Sure. So I'll speak to the psychological barriers first, then I'll get to the other part of it. So I liken trauma-sensitive yoga to exposure therapy. For anybody familiar with that term, exposure therapy to the body. So for people who might not know what that means, it's basically very slowly increased levels of exposure to the thing that causes you distress. So I'm deeply arachnophobic. If I wanted to get over my fear of spiders, I might approach someone who works with exposure therapy. Now, if someone were to tell me, Rachel, guess what? Tomorrow we're going to walk you into a room full of spiders and it's going to be great. You're going to get over your fear and it'll be perfect. I would go running as fast as I could in the opposite direction. I would never, ever, ever come back. So it's the same kind of idea, not the same thing, but same kind of idea when we're talking to people who have become, where your body has become so ingrained as this distressing and incredibly triggering thing that you live inside of. So there's prep work that has to happen with the therapist. Hila mentioned talking about it first, just talking about your body or healthy habits or these kinds of things, so that the foundation and the groundwork can be there, so that a person is in a certain place of kind of what to expect and how to digest what we're going to do. And then all along the line, there are these therapeutic stations, I don't know if you want to, or like pit stops that help a person kind of get over these therapeutic, kind of these psychological barriers. So getting to know me, kind of being in a room together with me, understanding exactly what we're going to do when we first meet, what to expect, all of these markers that can help a person kind of calm down the initial anxiety so that they can actually find themselves in a place where they are then able to go into their body and to start working together. So that's kind of a brief overall of the psychological barriers. Again, specifically the people I work with, and of course there's all kinds of different people out there who do different things in life, but the tragic reality is that so many survivors of complex trauma also find themselves on the lower end of the socioeconomic ladder. Again, not everybody. I don't want to say that as a blanket statement. But the people who I work with, I intentionally go into centers where the centers are the one that take care of my compensation, not the individuals, because I know that very often those people are choosing between medication or food or these kinds of very, very basic needs. And a lot of that has to do with the fact that, again, working with people who very early on in life were up against lots of disadvantages, the access to kind of those steps ahead were very much impeded from the get-go. Again, you've got people with complex trauma histories who are directors of Fortune 500 companies. I'm not debating that. But the people who specifically I see every day are on the other end. And so my dream is to find like some kind of funding or grant or whatever for this kind of work specifically for people who, really need it, really use it, but can't afford it. And that's especially relevant when it comes to private work because people who are not maybe immediate clientele or beneficiaries of the different treatment centers, they're going to come to me privately, and that's always very difficult. So that's what I would say in terms of both the therapeutic and economic.
Thank you.
I
Thank
want
you.
to add something very, very small that I think very important. When I said money is not an issue, and because there is always a way. One of the ways that I found through the years that to bring it to schools, to bring it into the big systems. Yeah, so for dance, for example, I had 100 teachers of dance, regular dance, that are giving classes from Kita Aleph ad Yud Bet, the whole range of ages. And I teach them the mixtability part. So if a child with crutches or wheelchair will come into their class, they won't tell him, I'm sorry, we don't have a place for you. We know what to do because we had a stage and we know that it's possible. Let's see what can we do. So that's why I said the how we will find a way. It's always, we need to be creative, but the spreading that this is the new way of healing, of community, this is the big mission for me.
A very important point. Thank you. All right. This is a question to any of our panelists as we're wrapping up our webinar today. So to our guests today that are listening to us, if there are people here who perhaps have not taken movement seriously as a form of psychosocial care until now, what is the one thing that you would want them to leave with today after hearing you speak? Go for it. Any of it's open to all of you or any of you who would like to respond. One thing that you would like them to leave with today.
I would say that our bodies are a resource for all kinds of untapped wisdom, that without directly experiencing your body in some way, doesn't matter, like it's less important what way, in some way, it's just kind of sitting there waiting. And so I would say, explore, experience, try it, see how you feel. And I think these are the homes that we were given when we were born. And just like any kind of home of brick and mortar, it needs to be a safe place to be. And without experiencing your body, it's hard to change that.
Thank you, Rachel.
I would love to add to what Rachel just said, the experience of movement. Allow yourself, if you haven't tried it, so just day after day, try to move a little bit more than the day before, and just experience the therapeutic qualities of what will happen within your body. We can talk about it for hours, but we must do it ourselves in order to experience that. And this is the first thing for me is when we want our patients to do it or anyone around us to do it, even when I think about my kids. So I never try to convince them to do any kind of sport or movement. They just look at me and I'm very happy for that, but they're looking at their father, and we do it as part of our daily practice so they can just learn from modeling. And for me, this is the most experience. We don't need to convince anyone, but when we do it ourselves, it's just like a social glue of doing something good.
My take-home message maybe is two words: transferable mastery, and what it does to trauma victims. When they learn new skills, when they acquire new identities as surfers or group members. And we have a saying in Agal Sheli, the sea goes with you. It's not just this 3 hours per week, it's throughout the week. And people start to meditate and start to use mindfulness exercises, because surfing is really a spiritual experience. So they reconnect with their bodies, with their spiritual world, and they take this new mastery, new skills, and apply it in other areas.
Thank you, Ariel. Tali, do you want to add anything?
Maybe a small thing. I wish for everybody, for all of us, courage to try new things that we never thought that we can do or we will do in our life. Just the courage and the curiosity, just to carry this and to be open and to see what is coming.
Such beautiful words. Thank you all. Thank you all very, very much for your participation. And I think it's clear that this is not a peripheral conversation, but this is a central conversation that we all should be having. And I will stay in touch with you all to continue this conversation. And yes, now is the time. Mari, I saw you raise your hand. Would you like to ask a question?
It's a question and a comment. First of all, congratulations to all of you on the vital work that you're doing. And what occurs to me is your work really needs to be incorporated into best practice guidelines of professional organizations. And some of the comments were just so important. I mean, Hila, you mentioned that this really should be suggested in the treatment plan of physicians, and I would recommend maybe contacting the group Mentally. It's at a Sheba hospital, and they're doing AI psychiatric evaluations and coming up with treatment plans, and this should be incorporated for sure. And Rachel, your comment about access and resources and it gets to scale. But I think if these techniques become best practice, then it should be a covered benefit by the insurance companies as well, and that will help, the access to people who are less advantaged. And I think the research that potentially is behind all this is vital in terms of biomarkers and showing the physiological improvements with these techniques to prove their worth and then gain attention and access and resources. But really, congratulations. This is such an important part of things. And not only, for the trauma going on in your society right now, but really for the rest of the world as well. So congratulations to this very important work that you're all doing.
Oh, thank you so much, Mari.
Thank you. And maybe just to reply to what Maura just mentioned, I shared with Alex, and probably she'll share it soon, but I do work on creating a hub for professionals in order to actually create these protocols. And I do take your recommendation to collaborate with Shiba, and this is part of what we do in the College of Management right now. We try to create more and more practitioners doing this wonderful work of providing these protocols to professionals, and hopefully we will see more of them. But when Alex shared the link, you can all go and see the knowledge that I try to manifest through this website.
Thank you, Hila. Any other questions? There's nothing in the chat, so. Okay, so in the chat, you can see there's a slide with all the details of all the panelists and how you can contact them if you're interested in learning more about their work or just being in contact with them. And my mail is there as well if anybody has any questions to me. And I will be following up with you, as I said. Hila, to talk more about convening and hub and as Tali mentioned as well, supporting each other's work and creating more visibility. That's something that we can all do together. So if there are no more questions, then thank you all very much for being here, and I hope it was enjoyable and interesting. Bye-bye.
Thank
Thank
you
you.
Thank you very much. Have a
Bye.
nice evening.
Thank you so much.